So let's do this. What system are you working with to help you to maximize every question? Remember, it's not a race to how many questions you can do if you can get all the way to 150. The key in transformational thought is I need to prove that I am competent to be a nurse. So I'm going to take my time enough that I'm going to really look at each question and see what it's asking, understand it, and as well as apply the knowledge that I have to choose the right answer. So here's a question here. After receiving a dose of penicillin, a client develops dyspnea and hypotension. Nurse Celestina suspects the client is experiencing anaphylactic shock. What should the nurse do first? So as you know, when I talk about testing strategy, and I actually have my notes on testing strategy as well as a practice video on Etsy, Fulfill Your Divine Purpose on Etsy, that the first thing to do is to read the question, then to paraphrase it, because you want to put it in the mindset, your mindset, that you understand it. This is what you've been practicing as you've been reviewing your nursing knowledge. But so we're looking at a person who the patient was given penicillin and all of a sudden develops dyspnea and hypotension. They developed that. So we're thinking that they're going through anaphylactic shock. And what should you do first? So if I was writing my keywords on my whiteboard, I would definitely write, okay, we have a medicine, which is penicillin. They have dyspnea, which is trouble, difficulty breathing, and hypotension, if I can spell here. And then we're wondering if it is anaphylactic shock, right? And then also too, what's my first action? What am I going to do first? So ground yourself in what's going on. So this person is experiencing trouble breathing. That's a red flag. That's a no-no. So remember, we're going to basically, medicine helps to do the opposite of what the patient is experiencing. So if they're experiencing a problem, the solution to that is going to be automatic, that I want to increase breathing, right? So I want to help them with increasing breathing and get that blood pressure up. Also, to basically reverse the effects of anaphylactic shock, because we know that's not good. It's life-threatening. They can die. A, do I page the anesthesiologist immediately and prepare to intubate the client? We're leaving the client. There's something you can do. When they say first, there's usually something you can do first. B, administer epinephrine as prescribed and prepare to intubate the client if necessary. Sounds good, because I know epinephrine is part of that flight response, if I can talk here. And it actually stimulates the lungs to bronchodilate, right? So that would be the opposite of dyspnea, because evidently there's some bronchoconstriction going on. Administer the antidote for penicillin. So what you have to know is there an antidote for penicillin? Currently, there is not an antidote for penicillin. So that statement is false, just looking at it. So I'm not going to choose that. Insert indwelling urinary catheter and begin to infuse IV fluids as ordered. That is not getting to the root issue. So even if I was to go between A and B, A is basically leaving the client. B is I'm doing something now, and I know epinephrine helps to bronchodilate. Remember, always say your rationale before you actually go to the rationale for the question. And here we go. The correct answer is B, because it's a potent bronchodilator. Knowing how the body works, it is a catecholamine that is part of that flight-fight response, as well as it bronchodilates, right? It stimulates the heart also too as well, right? Those beta receptors. A, you can see the antidote. When we're talking about A, we see the rationale here. The physician ordering other medicines. C, no antidote. And D, again, it's not getting to the root issue. So we're not going to choose that. Hey, you guys, you can do this. The basic thing is you got to look at what system you're using. As you work these questions, what's the rationale? What's your rationale first? What is the rationale? And you need to look and see, is my thinking aligning with the rationale for the question? You can find some great free content on Nurse Labs, as well as questions with great rationales on Nurse Labs. Remember, you can do this. If one person did it, you sure can do it. It's not a race. It's to prove that I am competent enough to be that nurse, that licensed practical nurse, that registered nurse, to take care of the patients that need you the most. I'll talk to you guys soon.